Hi guys, Dr. Brenda Slovin here from yourmigrainedoctor.com. Is what you're suffering with a chronic sinus headache or is it a migraine? It's important to know the difference. Migraines are often mistaken as chronic sinus headaches and vice versa. In fact, 90% of self-diagnosed sinus infections are migraines, but there are some telltale signs of sinus headache that are rarely, if ever, associated with migraine. So now that we're in the full swing of allergy season, it's time to take a closer look at the relationship between sinus headaches, headaches caused by allergies and or infection, and migraine. Knowing the difference, this can save you lots of time, energy, and pain. So what's the difference? What's the difference? This could be the most important question that we could possibly ask because really sometimes they can feel like exactly the same thing. With initial sinus infection symptoms, they overlap those of a migraine. So things like forehead and facial pain, runny noses, sinus pressure, sneezing, nasal congestion. True sinus headaches are generally due to a sinus infection. They're characterized by more serious symptoms. Symptoms like fever, pus in the nasal cavity, foul smelling breath, or difficulty with smell. Without those symptoms present, there's a good possibility that you're suffering with a migraine. A sinus headache is generally located in specific areas of the head, usually right over your affected sinuses. Migraines, however, they can be trickier. They can be acute. They can be slow onset. They can be localized to one area or they can be diffuse. They can even travel from one part of your head right over to the other. Your face can hurt, and the migraine can be provoked by any number of triggers. Whereas a sinus headache is the result of a viral and a bacterial infection. Literature all over the internet will warn you against not treating your sinus infection. They'll tell you all these symptoms to watch out for. They'll try to scare you. But before you jump on the fear wagon, I urge you to consider just a few things first. Look at your personal and family history for migraine, headache, sinus infections. Do you have a history of these things? The research clearly states that sinus headaches are rare and they're usually accompanied by obvious infection symptoms. Whenever you think you have a migraine, look for other symptoms. Try to narrow it down. Is it an infection or is it really a migraine? Research shows us that one of the most common misdiagnoses in migraineurs is sinus headache, leading to inadequate treatment and years of continual struggle for the poor patient. In fact, most of these sinus headaches, they're considered migraines with sinus symptoms. That's definitely not the same thing as a sinus headache. So, do you have a migraine with sinus symptoms or a real sinus headache? Well, do you have a fever? Are you known to have allergies or asthma, especially this time of the year? How disabling are your headaches, particularly over the springtime months? Do your headaches interfere with your ability to function? Do you experience nausea or aura? Are you sensitive to light? Is your pain pulsing, throbbing? It's best to get advice from your provider and determine the appropriate diagnosis and the appropriate treatment. It really could be that your allergies are a trigger to your migraine rather than a trigger to a serious infection or sinus headache. Just food for thought. I'm Dr. Brenda Slovin from yourmigrainedoctor.com. If you found the information in this video helpful, please click the like button and share it. You may be helping somebody more than you know, and I'll see you in next week's video. Until then, bye-bye.